Thank you for coming back. In lieu of time, we have, I think, buses roughly 7 o'clock to catch to take us for dinner. So we're going to start again. It's not on? Okay. That's better? Is that better? There we go. Okay, so we're going to restart this session, and then we'll go straight into the microfluidics session afterwards. So our last but one speaker in this session is Ling Peng, who's in the CNRS at the University of Marseille. And she's going to talk to us about Dendrimer nanotechnology for biomedical applications.
Okay, thank you. Thank you very much. And it's always my pleasure to join this event, because through this event I know a lot of colleagues and participate in the different EU projects, and to push the nanotechnology which we have had in Marseille into biomedical applications. So today I will try to present the recent advance and the recent progress in our group in Marseille about Dendrimer nanotechnologies for biomedical applications. So I think I can skip up the introduction, because everybody in the audience knows what is the nanotechnology-based drug delivery, because the nanotechnology-based drug delivery, they explore the microenvironment of the tumor or disease tissues and the nanosize of materials which can bring the drug therapeutics or image agents specifically into the tumor tissues or into the disease site for enhanced drug efficacy, and also no drug toxicity and avoid drug resistance, or for the imaging, improve the imaging sensitivity and specificity while avoid the toxicity. So I will skip up this EPI effect, because everybody in the audience knows very well. And what we want to mention is that today we already heard a lot of different nanomaterials today for the drug delivery, for the nanobiomedicals. And right now, what I'm trying to mention is that the dendrimers. And the dendrimer is a special synthetic macromolecules that have very well-defined structures, and they also have unique multivalence. And this unique multivalence is concentrated in a small, tiny three-dimensional volumes. And so dendrimer is per object is a nano object. And also because of these unique properties, and the dendrimer is very advantages for drug delivery. If we compare with the dendrimers with the different nanocarrier right now in the clinic, we know that lipid went into the clinic, and also polymers, which we heard of a lot today, and also the antibody, all of them are already in the clinic. All of them have the advantages and the disadvantages. For example, the liposome, they have the unstable formulation, while the antibody have very low payloads, while the polymers that have uncontrollable structures and chemical compositions. While using our dendrimer, self-assembly dendrimer nanocarriers, we hope that we can overcome this disadvantage by bringing the stable formulation and high drug payload, while with precisely controlled structures and targeted strategies. So this is the amphiphenic dendrimers which we developed in Marseille, and it is very simple, small amphiphenic dendrimers which compose a part of hydrophobic part and a part of hydrophilic part. So the self-assembly of these amphiphilic dendrimers, they can form the nanomicelles, and these nanomicelles we can put the hydrophobic drug into the hydrophobic interior for drug encapsulation and the drug delivery, while for the surface, which is hydrophilic surface, which we can make the surface with positive charge, which can be interacted with selective charged hydrophilic nucleic acid for gene delivery, for gene therapy, while also on the surface we can put a lot of different image agents. So because of Dendrimer's multivalent effect, we can have a lot of copy of image agent, so we can improve the sensitivity of the imaging efficacy. So from all of these different self-assembly Dendrimer nanotechnologies, I will try to, for each case, mention 1 or 2 examples to illustrate how this technology can be exploited in biomedical applications. So first of all, for the drug delivery, the Dendrimer nanomicelles. So if for the drug delivery, we always compare with what is already in the clinic, the lipid and the polymers. We know that the lipid and the polymers, they can also form the nanomicelle. But when they form the nanomicelle, you can see in the interhydrophobic core, they are very dense. So if they are very dense, they don't have a lot of space to encapsulate hydrophobic drug. In the opposite, if we have our amphiphilic dendrimer, we can see that in the interior we have a lot of space. And with this empty space, we can put a lot of drug. That's why using our dendrimer nanomicelles, we can achieve very high drug loading. And also, we can try to modulate the size of the hydrophobic part and the size of the hydrophilic part, so we can modulate the nano size. So in this case, what we have done is that we reduce the dendrimer core, and we can increase the drug loading. Oh, sorry. And also, And also that we can increase the dendrimer, the drug loading of the dendrimer nanomicelle, and also we can modulate the size to make the dendrimer nanomicelles in the size of 10 nanometers, 20 nanometers, or whatever. So we can simply change the hydrophobic part and the hydrophilic part. So here is the first generation of dendrimers, which is the most simplest one, which we have used for the drug delivery. It's very simple. We use a very small dendrimer polar, hydrophilic dendrimer polar head, and also we use a very simple hydrophobic chain as a hydrophobic part. And here have the 2 hydrophobic chain. And these dendrimers, when they're self-assembled in the water, and they can encapsulate the drug inside the hydrophilic part, and they can achieve very high drug loading, and they are very small in size, around 10 nanometers, 12 or 10 nanometers, and they can accumulate into the tumor tissues because of the EPR effect. You can see they accumulate very specifically, and also because of the small size, they can penetrate very deep into the tumor spheroid. And here is 3D spheroid tumor models, which is drug resistant. So you can see with the doxorubicin, which is drug resistant, there is no drug uptake because they pump out the drug. While using our dendrimer nanotechnologies, which encapsulate the drug into the nanomicelles, we can achieve very deep penetration and more uptake in the tumor spheroid. And here is in vivo results in mice results. We can see that using our dendrimers, we can significantly reduce the tumor growth, while the drugs, the free drug, the clinic drug doxorubicins, they cannot either at low dose they have no effect, and at high dose they have toxic effect. So all of the mice died after 1 week, so we have no control to continue this experiment. And also, most importantly, is that we had a pancreatic cancer biobank in Marseille. We collect more than 200 patient tumor tissues, and we isolate the primary pancreatic cancer, and we tested our dendrimer nanodrugs. The red one and the green one is our dendrimer nanodrug with different dendrimers, but inside was encapsulated with the doxorubicin anti-cancer. And the light blue and the dark blue are the clinic drug of doxorubicin and the clinic nanodrug of doxorubicin, Doxil. And you can see among all of the patients of dendrimer nanodrugs have unique very homogeneous and effective anti-cancer activities, while the clinic drug, doxorubicin and doxil, half of them have no effect at all. That's why we know that for the pancreatic cancer right now, we don't have any treatment, effective treatment, and the patient have to died very quickly. And also we are able to demonstrate that our Dendrimer nanomicelles, they can enter into the tumor cells through macropinocytosis, and through this uptake mechanism, they can bypass the drug-resistant mechanism. They can bypass the pump out by the GPG pump so they can overcome the drug resistance. So this is examples which we use Dendrimer nanomicelles for drug delivery for anti-cancer activities. So, different from we using the interior hydrophobic interior for drug deliveries, we can also explore the surface, charged surface, to deliver negatively charged nucleic acid. And here we use the examples to deliver small interfering nucleic acid. And here the examples show you that with these simple amphiphenic dendrimers, we can form the nanoparticles. And also these nanoparticles is small, it's around 7 or 10 nanometers. And these small nanomicelles interact with the negatively charged nucleic acid, and they form the nanoparticles around 100 nanometers. And these nanoparticles can protect siRNA from degradation, because we know small interfering nucleic acids are very sensitive to RNA aids, to the enzyme which is in the biofluid. And we can also, it also achieve effective gene silence effect in vitro and in vivo. And most importantly, through the European project, which we collaborate with Institute for the Immunotherapy recently, we have demonstrated that our dendrimers can deliver small interfering RNA into the macrophage, microglia, and also into the natural killer cells. So we are very happy to be in the European consortium, to be in the European project, to work with other partners who have different expertise to use our dendrimers for biomedical applications. And also that this is, I need to show you in our nano center in Marseille, we are able to engineer different amphiphenic dendrimers for different self-assembly. We can self-assemble into nanomicelle with this kind of dendrimers, and also we can self-assemble it into vesicles in this, using this kind of dendrimers that have 2 hydrophobic chains and 1 polar head, and also this polar amphiphenic dendrimers, which has 1 hydrophobic chain in the middle and 2 hydrophilic head groups, and for the different siRNA delivery. And I'm very happy is one of these dendrimers have been scheduled for clinical trial at Hong Kong University through our collaboration with Hong Kong University in the tumor model of ovarian cancer cell. I didn't go into details here. And also here is that using these technologies, we can try to decorate the peptide ligand for targeted delivery, and using the targeted deliveries, we can reduce siRNA more than 10 times. Because usually, without targeting the strategy, the siRNA dose is 3 milligram per kilogram for in vivo, and in our case, if we use the targeting strategies, we can reduce the dose to 0.25 milligram per kilogram. So finally, I will try to show you that our results using these Dendrimer nanotechnologies for imaging. And as the same principle is also the same, that these amphiphenic dendrimers forms nanomicelle, and use for the hydrophobic image agent, we can encapsulate it within the nanomicelle, and for the hydrophilic image agent, we can put it on the surface of the Dendrimer nanomicelles. So here shows you 2 examples. One is for the fluorescent fluorescent optic imaging of tumor, and this is the radio imaging of the tumors. And here is just show you the details, how it works, how how the results is nice with the Dendrimer encapsulation and without Dendrimer encapsulation. You can see without Dendrimer encapsulation, you didn't see any significant imaging results at the tumor, while here, this one is to show you, to show you that with our Dendrimer nanomicelles, we can have the radio tracers for the PET imaging. And here is the clinic FDG PET imaging. You can see it. We use the different tumor models, which is very difficult uptake by the glucose, such as the pancreatic cancer. Here I only show the pancreatic cancer. Actually, we did the glioblastoma, prostate cancer, colorectal cancer, and pancreatic cancer. And we can see that with the nanomicelle, we can significantly increase the signal and the noise signals to increase the sensitivities. So I think my time is over. So just want to show you that with the Dendrimer nanotechnologies, we can use very simple model, because I think this morning we heard about that the complexity is one of the difficulty for the translation. So we try to use very simple model for the drug delivery, for the gene delivery, and for the imaging agent. And we are very happy that you see we are right now working on these nanotechnologies to use our Dendrimer nanotechnology for combine the drug and the gene deliveries with targeted deliveries for tumor therapy, cancer therapies using cancer stem cell, and also for immunotherapies, and also for the anti-infectious disease. And finally, also we are working on the try to using our nanotechnologies to establish theranostics for the precision and the medicines. So I think I will finish here by acknowledging all of the collaborators and also all of the funding agents. And here is the Here is the Mediterranean Sea, which is near our campus after 20 minutes walk. So in case you are welcome to Marseille to set up the European project. Thank you very much.
Thank you, Ling. We have time for a quick question from the audience. Anyone have a question for Ling? I have one. So your gallium-68 work, do you radiolabel the monomer of the Dendrimer first and then create the micelle version, or do you radiolabel the micelle? Because NOTA radiolabeling conditions are very harsh.
Yes, very good questions. Actually, we radiolabel first, because the radiolabel is at a pH 3 or 5 or 4. Yeah. So in these conditions, the micelle, even their form, they are not stable. And then after we radiolabel it, and then we put it in the buffer. And in these conditions, we check the nanomicelle, and we check all of these nanomicelles by DLS and TM. And actually, they are around 10 to 15, around 15 nanometers.
They self-assemble quite quickly then,
because
yes. Your half-life is very short.
Yes, because all of this self-sampling, we don't need to add any solvent, just put it in the water. Okay. So that's why a lot of biological collaborators are very happy to use it. Because if you ask them to make the film, to make the nanoparticles, they don't know how to make it. Yeah. If you told them just put in the water, they're very happy to use them.
Perfect. Thank you very much, Ling.
Thank you.